I'm Dr. Streicher. Your question is there a non-estrogen pill that treats vaginal dryness and painful sex? I'm going to give you the inside information. While local vaginal products such as a vaginal estrogen or vaginal DHEA do a terrific job of treating thin, dry vaginal tissue, a lot of my patients tell me they would just rather take a pill. And if you fall into that group for whatever reason, there is another option. Ospemifene is a daily oral pill, goes in your mouth, not in your vagina, to alleviate vaginal dryness and painful intercourse. Now, ospemifene is not estrogen. It's classified as a SERM, a selective estrogen receptor modulator. SERMs are drugs that either block estrogen pathways or activate estrogen pathways in specific tissues. So you may be familiar with some other SERMs. Tamoxifen blocks estrogen receptors in breast tissue and is commonly prescribed to prevent the recurrence of breast cancer. Raloxifene, another SERM, also known as Avista, stimulates estrogen receptors in bone to prevent and treat osteoporosis or osteopenia. Ospemifene is a cousin to tamoxifen and raloxifene, but specifically targets and stimulates estrogen receptors in vaginal tissue. And just like local vaginal estrogen products, ospemifene does alleviate painful intercourse due to menopause. Since ospemifene also appears to block estrogen receptors in breast tissue, most experts feel that this is a pretty good option for women with breast cancer. But having said that, it has not been tested in women with breast cancer, which is why there's a caution on the product label. And while it is reassuring to know that it did shrink breast tumors in rats, women are not rats. Ospemifene does weakly stimulate the tissue that lines the uterus, but reassuringly, there is no evidence that this will increase the risk of uterine cancer. And in the clinical trials, women had regular uterine biopsies to prove safety, to prove that there was no stimulation of uterine tissue. So while this is reassuring, any woman, whether she takes ospemifene or not, should evaluate any postmenopausal spotting or bleeding, and you may want to check out my videos on that topic. But ospemifene is not a magic bullet. It's not for everyone. If you're already taking a SERM, such as tamoxifen or raloxifene, you can't take it. If you're taking systemic estrogen for relief of hot flashes, but still have vaginal dryness, ospemifene is not an option for you. And about 7% of women actually get hot flashes from taking ospemifene. So if you're having a hard time with flashes, again, probably not your best option. But for many women, this is the way to go. And again, it's good to know all of your options so you can make a good choice. For more information about this and all your other options, you can check out my book, SexRx, Hormones, Health, and Your Best Sex Ever. And there's also lots more information on drstreicher.com and in my other videos.